Hello, it's Dr. Rhonda Johnson. Today is Thursday, October 12th, 2023. And today I'm talking about exercising cancer. And I'm summarizing a study that was published in the American Association for Cancer Research Journal, the clinical cancer research done by researchers at the University of Texas MD Anderson Center. And the study was published in September 2023. Now, I thought it was an important article because it looks at the biological effects of exercise in the immune system of patients who are at risk for cancer. Now, a disclaimer, I particularly find anything to do with immunology very complicated. And so I am oversimplifying these findings and their research. So basically, they looked at 21 patients who had Lynch syndrome. What is Lynch syndrome? It's a genetic condition that predisposes people to certain cancers at a young age. And so these study participants engaged in 45 minutes of high-intensity cycling 3 days a week for 12 months, and they compared them to a group that did not exercise. And so what they did was they tracked and did these biochemical and immunohistological studies. It's very complicated work on the cells in the immune system that are cancer detecting, the killer T cells and the CD8 positive cells. Now, what they found was that the people, the 21 folks who did the exercise, had better biomolecular profiles and had more activation of these cancer detecting and killer immune cells, meaning that the people who engaged into the vigorous exercise sort of had a boost in their ability to detect and kill cells that could become cancer cells. And so the researchers concluded that overall their data highlighted the role and potential of aerobic exercise as a non-pharmacological intervention that was preventive in Lynch syndrome population. Now, we've all known for a long time that exercise can reduce the risk of certain cancers. So, for example, bladder, breast, stomach, and colorectal cancer, the risk is decreased with regular exercise. So the bottom line is, I am not suggesting that you go out there and do 45 minutes of intensive cycling. I'm not suggesting that. Please always check with your medical provider, your physician, your healthcare provider before you begin any type of physical activity program, especially if you're sedentary or you have conditions that, you could experience complications. So, but the bottom line is this shows at a biological level the benefits of exercise in a high-risk cancer-prone population. And how that generalizes to the rest of us, I'm not sure, but I think it's something that we can take note of. All right, that's my message today. As always, be safe, be well, and do take care. And I will include the reference link for those who want to do a deeper dive into the report.